Picture this. You're at home, the kettle is humming, and you're deciding between a crossword and calling a grandchild. Then your face feels off. Your hand can't grip the mug. Your words come out thick like you've got a mouthful of peanut butter. In that exact moment, the clock isn't just ticking, it's carving away at brain cells. This is the scenario no one wants, yet too many of us face alone. Here's the part that most people miss. What you do in the very first minutes can change the ending of your story. There's a simple sentence, 10 seconds to say, that can mobilize the right team, the right equipment, and the right path to treatment faster than anything else. We'll get to it, and you'll practice it with me. My purpose today is straightforward. If you ever face stroke symptoms alone, you'll know precisely how to act, where to put your body, what to say, and what not to do, so you give your brain every chance to heal. Keep listening, because each step builds on the last, and by the end, you'll have a plan you can remember under pressure. Let's talk about your lifeline before a crisis begins. Your emergency contact system. We don't start building parachutes after the plane loses altitude. Same rule here. Your phone can call for help without a passcode if you enable emergency SOS. On most smartphones, rapid presses on the side or power button trigger it. Spend 5 minutes today adding emergency contacts, your medical conditions, medications, allergies, and any blood thinners to your phone's medical ID. That information can display on a locked screen and guide first responders when you can't. Consider a wearable alert you'll actually wear, on your wrist, clipped to clothing, or as a pendant. The best device is the one that's on you in the shower, in the yard, and by the mailbox. Look for options with fall detection and cellular connectivity so it works away from home. Then create a simple vial of life, a one-page sheet with your diagnoses, meds with doses, allergies, physician numbers, and emergency contacts. Put it in a clear bag on the fridge door and a copy in your wallet. Update it anytime your prescription list changes. When symptoms hit, staying awake and oriented buys time for treatment. No, it's not about grit. It's about giving your brain the conditions it needs. Start with steady, gentle breathing. Not big dramatic breaths. Those can drop your blood pressure. Aim for a calm rhythm you can count. In for a quiet 2, out for a slow 2, about 12 to 15 breaths a minute. Counting does double duty. It organizes your breathing and keeps your mind engaged. Next, get your head slightly elevated, about the height of 2 thin pillows, not upright and not flat. If you're on a sofa, slide down so your shoulders and head rest at a gentle angle. On the floor, lean against a couch base or a wall. Eyes open. Fix your gaze on one object, a picture frame, a lampshade, and describe it out loud. The color, the edges, the shape. This simple act of focusing, naming, and narrating can help you maintain alertness. If your vision doubles or the room spins, keep your eyes on a single point and blink slowly. Your job in these minutes is to remain present, breathing, and observable. Now we need to put your body where it helps you most. Movement can be tricky and dangerous during a stroke, so think low and stable, not up and walking. If you're standing, lower yourself carefully to the floor using furniture. Don't try to be heroic. Falls cause avoidable injuries. From there, roll onto your side with your head slightly raised. If your left arm or leg is weak, the right side may feel safer. If the right side is weak, the left may be better. Bend the top knee and place it in front for stability so you don't roll onto your belly. Support the affected arm. Never let it dangle. Slide a cushion, folded towel, or even a rolled sweater under that arm to keep the shoulder aligned. Aim your head at a gentle angle. Think 2 stacked paperbacks under your temple. Not so high that your chin collapses to your chest, not so low that you're flat. This position helps protect your airway if you vomit and may support better blood flow. If swallowing is hard, turn your face slightly downward so saliva dribbles out rather than back. Small details, big difference. We have to talk about medications, because this is where myths can do harm. Here's the safest principle if new stroke symptoms begin. Do not take any additional medication unless a clinician or 911 dispatcher specifically instructs you to. Many people reach for aspirin. The problem? Without imaging, we can't confirm whether it's a clot-caused stroke or a bleeding stroke. Aspirin may help with clots, but it can make bleeding worse. If a telehealth clinician or EMS tells you to take aspirin, chew it so it works faster. Otherwise, wait for medical evaluation. Don't swallow extra doses of your blood pressure pills in a panic. During the acute phase, overly lowering blood pressure can reduce the blood flow your brain needs. Continue your medications as usual unless you're told otherwise, but don't double up thinking more is better. One more vital step: your medication list and any blood thinners you take, warfarin, apixaban, rivaroxaban, dabigatran, clopidogrel, must be visible to responders. Put them in your medical ID, on a wallet card, and on the fridge list. Label them clearly: name, dose, timing, and why you take it. Your voice is more powerful than you think, even if words are slurring. The moment symptoms begin, start speaking out loud and keep speaking. Narrate what's happening. The right side of my face feels weak. My right hand is clumsy. It started at, and say the time. If you can't recall the exact minute, look at a clock and read it out loud. This does 3 jobs. It stimulates language and attention areas of your brain. It generates a timeline that's priceless for doctors deciding on treatments. And it increases your chances of triggering a smart speaker or a voice assistant if one is within earshot. Can't form full sentences? Use short, repetitive phrases. Stroke, help, 215. Stroke, help, 215. If you're in an apartment or townhouse, raise your volume and vary the sound. Say your name, bang 3 times on the wall, then repeat. Make noise every minute or 2. If swallowing your pride is the cost of getting your neighbor to knock on the door, pay it gladly. To you, it may feel messy. To responders, it's invaluable information and a beacon. Let's plan the first 60 minutes, the golden hour. Think of this as a checklist you can do even under stress. Minute 1. Assume stroke. Don't shrug and wait to see if it passes. Call emergency services immediately. Lead with the words, "I'll teach you soon." If you can, put the phone on speaker, set it next to you, and keep talking. While connected, unlock or wedge your front door open with a shoe, turn on outside lights if it's dark, and call out, "I'm in the living room," or "I'm on the bedroom floor," so responders can find you quickly. Minutes 6 to 15. Move pets into a bathroom with water, if safe, so they don't bolt or block responders. Get yourself into that stable side-lying position with head slightly elevated. Minute 15 to 30. If you can still write or tap your phone, text a family member or neighbor with stroke symptoms started at time. Door is unlocked. This creates a timestamp. Minute 30 to 60. Stay on the line if the dispatcher asks you to, follow their cues, and do not attempt to drive. If a neighbor can take you to a stroke-capable hospital faster than an ambulance can reach you, discuss it with the dispatcher. In many regions, EMS still gets you inside and scanned faster. We need to address something uncomfortable but essential. You may lose words, coordination, or confidence mid-crisis. That's not failure. That's physiology. Your job is to keep feeding responders the 2 most important facts: stroke and time started. If you can speak, anchor to those and repeat them every few minutes. If you can't, text if your fingers will cooperate. Stroke, your address. Time symptoms began. Most emergency centers can receive texts. If your local area doesn't, the message still sits on your phone for a responder or neighbor to see. Keep your phone near your chest on speaker. If the screen times out and you can't unlock, keep talking. Many dispatchers are trained to listen for slurring, breathing changes, and altered awareness. Those clues help them prepare the arriving team. If your voice fades, hum or tap the phone casing to let them know you're still there. If your front door can't be unlocked safely, tell the dispatcher exactly which window or door responders can break. And if you have security cameras or alarms, mention them so the team can avoid unnecessary delays. Let's circle back to the tech that works when you can't. Set up Emergency SOS on your phone today. Add stroke, use code word to the top of your medical ID, and we'll define the code word in a moment. Explore your phone's emergency sharing feature. Many smartphones can automatically send your live location and a short message to selected contacts when you activate SOS. Choose 2 or 3 reliable contacts: a neighbor, an adult child, a sibling. Tell them, if you get an SOS from me, call emergency services to my address and head over if you're nearby. Consider a smartwatch with a cellular plan if you live alone. Practice triggering its emergency function once or twice so your hands remember. Then rehearse a 5-line drill. Press SOS, say the key phrase, state your address, say the time symptoms began, and your age. Age matters because it helps dispatchers prioritize stroke-capable transport and informs treatment windows. Finally, keep a spare key in a lockbox outside with the code shared in a sealed envelope with a neighbor you trust. Precious minutes are saved when responders don't need a battering ram. Quick sanity check on prevention behaviors that help you if a stroke strikes anyway. Hydration matters. Thick, sludgy blood flows poorly. Sip water regularly throughout the day. An easy cue is a glass at wake-up, at lunch, and mid-afternoon. Keep moving. Simple seated marches, ankle pumps, shoulder rolls. Small movements maintain circulation and reduce clot risk. Sleep with your head and neck supported. Snoring, untreated sleep apnea, and frequent nighttime awakenings can raise stroke risk over time, and good sleep architecture supports daytime blood pressure stability. Manage blood pressure with your clinician. Know your baseline. If you own a cuff, bring it to an appointment to calibrate it. Keep cholesterol in range, manage diabetes carefully, and if you smoke, consider this your nudge to seek support to quit. Prevention isn't glamorous. It's accumulative. And if a stroke still breaks through, the same habits make your brain more resilient. Strong bodies recover better. Confident minds act faster. Prepared homes save minutes. If this is helpful, take a second to subscribe to Senior Vitality Pro and tell me your age or where you're watching from in the comments. I read them, and your answers shape future topics so I can tailor these plans to your reality. The more I understand your stage of life, the better I can serve you. All right, the sentence I promised. When you call emergency services, begin with, "Stroke alert. I have stroke symptoms starting now." Short, clear, direct. Not, "I feel odd" or "I think maybe." Those words, stroke alert, help dispatchers prioritize stroke pathways where available. Immediately follow with your exact address, then the time symptoms began, then your age. It sounds like this. Stroke alert. I have stroke symptoms starting now. 1720 Maple Lane, Unit 3B. Began at 2:15 p.m. I'm 68. If you're not sure of the exact minute, give your best estimate and say, "Last known well was around time." Put the call on speaker. Stay on the line. If you have difficulty speaking, repeat 2 words: stroke, time. If you can text, send, stroke alert, address, time started, age. Then keep the phone near your face. If you live in a region that uses a different emergency number, write that script on a sticky note by every phone and place a copy in your wallet. Timing continues to matter even after the call. The sooner your brain is imaged, the sooner a team can decide if a clot-busting medicine or a mechanical clot removal is appropriate. That's why we aim for rapid transport to a stroke-ready hospital. If you have a choice of facilities in your area, ask your primary care or neurologist today which nearby centers are certified for stroke care. Write that name on your fridge and phone notes. During the emergency, do not delay waiting for a particular hospital unless directed by dispatch. EMS can route you. If you are alone and think a neighbor could get you there faster, Ask the dispatcher. They can compare ETA. Most often, paramedics bypass waiting rooms and drive you straight to imaging. That's speed you can't replicate in a private car. And remember, symptom onset time governs eligibility for certain treatments. That's why you name the time early and often. Your words become your ticket to options. Let's practice a mini rehearsal. Think of it as muscle memory for your mind. Say it with me. Stroke alert. I have stroke symptoms starting now. My address is your address. Symptoms began at time. I am age. Door is unlocked. I'm on the room. Now again, a little faster, but still clear. Imagine you're speaking through a cotton mouth. You hit the keywords even if the rest blurs. Stroke alert. Symptoms now. Address. Started. Time. Age. This is not overkill. It's preparation. Place a small card by your phones with these prompts. Say, stroke alert. Address. Time. Age. Stay online. Put unlock door, lights on, pets contained on the same card. Place a folded towel next to your couch and bed. Instant head support. Store a cheap wedge doorstop on the entry table. A gentle kick wedges the door open so responders can enter. These tiny cues reduce thinking load when you least have it to spare. We've discussed the body and the call. Let's reinforce how to stay conscious with a practical kit. Create a focus box within reach in the living room and bedroom. A cheap digital timer, a bright sticker you can stare at, and a pen. If symptoms begin, set the timer for 5 minutes and hit start. Every time it beeps, say the time out loud. Stare at the sticker and describe its shape and color. Write the time on your hand or forearm if you can. It's not about neatness. It's about leaving clues. If you have a smart speaker, enable emergency calling features where available, and teach it a simple command you can remember. If you don't trust tech, that's okay. Your voice and a phone are enough. Pre-place a bottle of water with a sports cap near your favorite chair. Take tiny sips if your swallowing is safe, but if coughing starts, stop and turn your face to the side to let saliva drain. Being prepared isn't paranoia. It's compassion for your future self. What about after the ambulance arrives? Your preparation continues paying off. The list on your fridge saves 5 to 10 minutes of questioning. Your unlock and lights routine spares forced entry. Your short, consistent language, stroke alert. Time started, guides decisions. If you can answer yes, no, keep answers short to preserve breath for what matters. If you wear dentures, keep them in a case by the bed so they can be removed quickly if needed. Wear shoes that slip on easily or keep socks with grippers handy. If you need to be transferred, traction helps. Pack a small go envelope near the door with a copy of your ID, insurance card, medication list, and a contact card. Label a charger with your name and drop it in that envelope now, because phone batteries always seem to vanish in emergencies. If you live rural, include directions formatted the way a human would say them. Third house on the left after the red barn. Dispatchers can relay that clarity to the responding team. Let's defuse a few persistent myths. Myth 1. If symptoms improve, I'm fine. Some stroke symptoms wax and wane. Transient improvement doesn't mean safe. Call anyway. Myth 2. If my blood pressure is high, more medication now will fix it. During acute stroke, abrupt blood pressure changes can harm. Take medications as prescribed and follow dispatcher instructions, but don't self-adjust. Myth 3. I'll be embarrassed if it's a false alarm. Embarrassment is cheap. Delay is expensive. Emergency teams would rather rule out a stroke than meet you later with worse damage. Myth 4. I'll just sleep it off. Sleep hides symptoms and steals your timeline. Myth 5. Aspirin always helps. Not true for all stroke types. When in doubt, don't take additional medication unless a clinician tells you to in real time. Replace myths with a mantra. Notice, call, position, breathe, speak, time. That's your chain of survival when you're solo. Caregivers and adult children, This part is for you. Walk through the plan with your loved one. Practice saying the script together. Program your numbers into their emergency SOS contacts, and make sure your ringer is on for emergency calls. Keep a spare key accessible or know the lockbox code. If you live in the same building or down the street, agree on a code text. Help stroke. That means call emergency services and go to them immediately. Print the medication list and tape it inside a kitchen cabinet too, in case a refrigerator magnet fails. If your loved one has limited mobility or advanced hearing or vision changes, consider louder doorbells, motion-triggered entry lights, and a bright "Emergency Key Here" sticker on the lockbox. Your preparation doesn't eliminate fear, but it converts fear into action. This is how families change outcomes, not just with love, but with logistics. Let's revisit positioning, because it's easy to forget under stress. The goals are airway protection, stable circulation, and joint safety. Side lying with the head gently elevated accomplishes all three. Avoid curling into a tight ball. It makes breathing harder. Don't tilt the head so far forward that your chin presses your chest. That narrows your airway. Don't let a weak shoulder hang unsupported. The ball and socket joint is vulnerable, and pain complicates recovery. If you must sit while waiting, sit slightly reclined, feet supported, chin neutral, shoulders relaxed. Avoid lying flat unless you're instructed otherwise by a clinician. And remember, don't force food, pills, or water if your swallowing seems off. Choking and aspiration pneumonia are preventable complications. If you feel the urge to vomit or cough, turn your face toward the floor side so fluids drain out, not back. Check your pockets now. Remove bulky items so lying on your side later doesn't compress a phone or keys into your hip or ribs. For those who love checklists, here's your alone during stroke. Quick plan you can memorize in 6 words. Call, clear, clock, position, breathe, speak, call, activate emergency SOS or dial your local emergency number and lead with stroke alert. Clear, unlock or wedge open the door, turn on lights, contain pets. Clock, note the time symptoms began. Say it out loud and write it if you can. Position, side lying, head slightly elevated, weak arms supported. Breathe, steady, shallow to normal breaths, eyes open, soft focus on a fixed point. Speak, repeat stroke, and the time. Narrate sensations. Keep the line open, or text if speaking fails. After you're treated and safe, debrief with yourself or a loved one. What went smoothly? What was hard? Adjust your setup accordingly. Preparedness is a living plan, not a one-time task. Revisit it every few months when you refill prescriptions or change your living room furniture. Let's talk about what happens at the hospital so you understand why we push speed and precision. First, a rapid assessment, vital signs, blood sugar, and a neurological exam that may feel like a memory game and a dance test. Then, imaging, usually a CT scan to distinguish between bleeding and clot-caused strokes. This distinction is everything. It decides whether clot-busting medicine or other interventions are an option. That's why your time last known well is gold. On the way, your medication list tells clinicians about blood thinners and interactions. Your age, symptoms, and timeline line up with protocols so teams can move decisively. You may get oxygen, IV access, and monitoring. Remember, your goal is not to be perfect. It's to be informative. Short, clear phrases win. Right arm weak, face droop, started 2:15. If you rehearsed your script, it will flow even under fog. You might be wondering, what if this happens at night? Nighttime adds darkness and disorientation. Place a small flashlight on your nightstand. Keep your phone on a simple charger dock you can grab with one hand. Practice the motion of rolling to your side and reaching for the phone without sitting fully upright. If you use a CPAP or BiPAP, you can pull the mask off if speaking is too hard, but keep it nearby so EMS knows you use it. A low-cost plug-in nightlight in the hallway can guide responders to your bedroom. If you sleep with the door locked, consider a privacy lock with a coin release or leave it unlocked and place a doorstop you can wedge quickly if you need privacy otherwise. Put your medication list on the inside of the bedroom door as well as the fridge. Start with a plan that works on your sleepiest day because that's when you'll need it. Let's do one more rapid-fire practice. This time, imagining your right hand is weak. You drop the remote. Your words feel thick. You take one breath in, one breath out. You say, "Stroke alert. I have stroke symptoms starting now." You hit the side button 5 times, or you dial. Speaker on. 1720 Maple Lane, Unit 3B. Began 2:15:68. You lower to the floor. Roll to your left side. Top knee forward. Head supported by a cushion. Right arm cushioned. Door? You've already wedged it or unlocked it. Lights on. Pets in the bathroom. You keep saying stroke 2:15 every so often. If your voice falters, you hum. You tap the phone twice every few breaths. EMS arrives. You're ready. This isn't drama, it's choreography, and you just learned the steps. Here's how to keep this fresh without living in fear. Tie your review to routine events. Every new prescription? Update the fridge sheet. First day of each new season? Rehearse the call script once. When you replace a smoke detector battery, check your wearable alert battery too. When you change your calendar to a new month, text your emergency contacts to confirm their numbers are the same. If you move furniture, make sure you still have a clear path to the door and a soft item within reach for head support. If you get a new phone, set up emergency SOS as part of your first day setup. And twice a year, take 5 minutes with a loved one to walk through the front door and pretend you're responders. How easy is it to find you? Where would you trip? Fix those snags now, when the stakes are low. Now, the last piece, self-compassion. If you've had a scare before, you might feel shame that you didn't act quickly. Please release that. Panic and denial are human responses. Today gives you a script that cuts through both. And if you're a caregiver who feels overwhelmed by one more thing, remember, you don't need perfection. You need a few simple habits and a practice sentence. Write the sentence somewhere you'll see it often. Stroke alert. I have stroke symptoms starting now. Stick it on the fridge, by the landline, inside the medicine cabinet, and as a note on your phone's lock screen. Consider teaching it to your grandchildren. They love being helpful, and it becomes part of your family's safety language, like stop, drop, and roll. Knowledge is freedom. It doesn't eliminate risk. It gives you power when moments matter. As we close, take a breath with me. In through your nose, out through your mouth. You now have a plan to act quickly if stroke symptoms appear while you're alone. Build your emergency system now. Position your body for safety. Use your breath and your gaze to stay awake. Keep your words simple and repetitive. Stroke and time. Avoid self-medicating unless a clinician directs you. Call with the key phrase and practice, because practice makes your brain faster under pressure. 1 in 4 of us over 60 will face stroke, but we are not helpless. Preparation is not pessimism. It's love for your future self. If you've had symptoms before or supported someone who has, share in the comments which step you're adding to your routine next. Your story might be the nudge that saves someone else's life.